The consultations to redirect focus on how HIV-infected persons are treated at workplaces started on Thursday at the Guyana Marriott Hotel in Georgetown with representatives from several agencies, including the Ministries of Labour and Health and the United Nations Development Programme, UNDP. Dr. Tarek Jagnarine, the program manager, said the consultations will be held among private and public sector workplaces that will be engaged by the Ministry of Labour.
These policies should address issues such as confidentiality, non-discrimination, access to health care, and reasonable accommodation. They must be developed through inclusive and participatory process involving the workers, employers, trade unions, and civil society organizations as we are doing today.
Dr. Jagnarine said the inclusivity demonstrates a commitment to equality and social justice by incorporating updated guidelines from the International Labour Organization (ILO), the Global AIDS Strategy 2021 to 2026, which outlines a roadmap for ending AIDS as a public health threat by 2030, is achievable. During the consultations, which are expected to be completed by September, employers will be informed of the updated policies and stakeholders will get to make recommendations and share concerns. In the end, the report will be taken to the Ministry of Labour. Gwyneth King, the Occupational Health and Safety Consultant at the Ministry of Labour, said the Occupational Health and Safety Department conducts multiple checks to ensure workplaces are compliant with these policies.
The Occupational Safety and Health Department has not received complaints from workers about discriminatory practices by employers. While this is so, it does not mean that such practices are not happening, and there may be a need, or there is a need, to increase or intensify our efforts.
She noted that this engagement proves there is a need for focus to be placed on the workplace to address issues employees may have. This is important because the workplace must highlight health-related issues and cater to the needs of its employees, Dr. Jagnarine said, adding that workplaces should offer support to HIV-positive employees and encourage voluntary testing. Notably, these engagements will also address health issues employees face, such as mental health and chronic diseases.
Our efforts should not be limited to the workplace policy alone. We should extend to promoting a culture of overall wellness and resilience. This means right within our workplace addressing mental health. When last have your workplace had a mental health discussion? Promoting work-life and balance. It's not just about work. If you have staff that are burnt out, cannot be produce the quality of work that they have. In a few days, they're going to get sick, they're going to stop coming to work, and productivity decrease. We also must provide comprehensive health care benefits, not only for our employees, but their families.
For many years, persons living with HIV have been discriminated against, especially for employment. Hence, the HIV workplace policy launched in 2009 protects HIV-positive employees against discrimination, victimization, or harassment. The ILO has an updated policy framework that NAPS will use for these consultations. Reporting for the newsroom, I am Ozina Yearwood.